Wherever life plants you, bloom with grace. Hey there and welcome to Soul Deep with Sheila. I am Sheila Cheptoyek.
Right here at Fairway Hotel.
Now last week we had Shiba Lukwago that shared her journey and her story as a caregiver to her mother that is diagnosed with dementia. And this week we would like to have a doctor's perspective. So we have brought a doctor on board to just share with us, highlight us on what dementia really is. And today we are privileged to have Dr. Paul Chiwanuka Muchibi, who is also a General Secretary of Uganda Alzheimer's Association, here with us. Hello, Dr. Paul.
Hello, Sheila.
How are you doing?
I'm very well, thank you. How are you?
Fine, thank you. So good to have you.
Good to have you, and I love the quote you started with, wherever life puts you,
Yes.
bloom with grace. That gives us a very good setting to what we're about to talk about.
That's for sure.
A lot of grace is
Yeah,
needed
that's
when
true.
Alzheimer's and dementia is
Thank-
involved.
Thank you. Yes. So just before we actually delve into it, who is Dr. Paul Muchibi?
Dr. Paul,
Yeah.
which aspects do you want to know? I'm a father of two
All aspects,
wonderful
okay.
boys.
Okay.
Who were all kept very well in line by their wonderful mother, my wife.
Okay.
Yes. My youngest is 17, going to be 18.
Oh, wow.
Yes.
Youngest.
Yes.
Okay.
Right. The younger of the two. So I'll take your "oh wow" as a compliment. Thank you.
Yes, it is. Yes, it is.
I'm a medical doctor, but I stopped. I no longer practice clinically. I moved into the health development sector, and for want of a better phrase, I'm a health research and policy specialist.
Okay.
I have my own consulting firm, that's PS Consulting,
Okay.
and most of the people I've worked with is ministries of health across the region, the donors, the advisory role, evaluating large donor projects or advising ministries on policy development, etc. Just, I suppose, giving a slight idea
Okay.
of what it's involved work-wise. What else do you want to know? I came back to Uganda in the 1990s,
Okay.
having been part of the group that left Uganda very, very fast
Okay.
in the early 70s. So I didn't grow up. A lot of my earlier childhood was elsewhere
Oh.
in the world.
In the somewhere in the world.
Yes,
Just
yes,
not Uganda.
Not Uganda.
Okay.
But I came back and decided to stay. The majority of my siblings
Okay.
don't live here.
Okay.
They stayed where they are.
Oh. So you're the only one who came back
No,
amongst your siblings?
Others came and then finally left and decided
Oh,
not
okay.
staying.
Okay.
Yeah.
All right.
So that's it in a nutshell, I guess.
Okay.
Unless there's something else you want to know.
Well, I guess that's fair enough for us to really get to know you. And it's really good to have you as well.
Thank you.
Thank you for making time. So it looks like you really do quite a bit, huh? Your life, there is this, there is that. There's just, I just wonder how you find the balance between doing all of that.
How to find the balance?
Yeah.
Play with your boys.
Okay.
If you have daughters, play with your daughters.
Okay.
They'll keep you balanced.
I see. I haven't had that one.
They'll keep you balanced.
Yeah.
You get to the point where the balance comes from focusing on the needs they have,
Yeah.
the attention they want.
Yeah.
Then later on, the balance comes from trying to keep up and realizing you can't.
Yeah. Interesting. It comes
Yes,
from playing and then also keeping up and realizing you can't.
Yes. No, but apart from that, it's a very good question. There was a time where, yes, it was all work to
Yeah.
keep on staying on top of things until this was a long time ago, until I realized that no, this is not what it's supposed to be about.
Yeah.
And then I shifted gears where the norm would be that I must be at home for dinner at the table with the whole family. So it would be the exception
Yeah.
that I am not there.
Okay.
Yes, and it was conscious. It had to be, otherwise
Yeah.
there is always something else to do.
Yes,
You
that's
see?
true.
There's
Yeah.
always something else to do.
Yes.
And the other part from balance is have a life out of
What you do.
apparently must be done.
Okay.
There are people out there, there are friends out there, there's family out there, there's your own immediate family. That's where balance comes from. Balance comes from people
That's right.
that you're with, as opposed to the different things. I
Wow.
think.
That's an interesting perspective. I'm taking that, and it's really good to think about life in that way. You know, have that kind of perspective. I think it helps a lot not to forget the most important things
Yeah.
in life. All right, so if we can just delve right into it. Dementia. We want to understand what exactly is dementia. Last week we had Shiba here with us, and she shared her journey as a caregiver to her mother who was diagnosed with dementia. Now we just really want to hear from you as a doctor, as you know, somebody that really has command in this area. What is dementia?
Okay.
Yes.
I'll start off by looking at the way you asked it, what exactly
Yes, what
is
exactly
dementia?
is it? Yeah.
The exactly part is really actually important because even we actually don't exactly know what causes it. Okay. However, over the especially last 10 to 20 years, there's been a lot of progress in the understanding of dementias, of which Alzheimer's disease is the most common. About 50 to 70%
Okay.
of all dementia patients or cases are actually Alzheimer's disease. There are other forms of dementia. I'll go into that later.
Okay.
So when it comes to what exactly is it?
Yes, what exactly
I will define dementias this way. Dementias or dementia refers to a group of symptoms, okay, that are caused by conditions that actually lead to damage of the brain cells. So a dementia is, as opposed to being one specific thing, it comes from a set of symptoms that have been caused because the brain cells are being damaged and dying.
Okay.
Okay? There are different causes of dementia. What actually causes that to happen, for example, Alzheimer's, we're not exactly sure. What we do know is that it's probably a combination of factors. Genetic factors, environmental factors, lifestyle factors, other risk factors. In Alzheimer's case, the greatest risk factor being age.
Age,
Okay?
okay.
Yes, is the greatest risk indicator once you reach a certain age. But you can't pinpoint it in the same way that malaria is caused by Plasmodium falciparum that is transmitted by this mosquito. You can't even pinpoint it in the same way that these set of symptoms, what is happening in the world now, is caused by the coronavirus, the SARS-CoV-2, which leads to the COVID-19, you see? So in that particular respect, no, it's different
Okay.
in being able to say what exactly it is.
Okay.
Yes,
So what
sir.
you're saying is, when somebody comes, you as a doctor, you have to identify what, for each person, you have to there's a different cause for each person.
Yes and no.
Okay.
The majority of dementias we see now are actually Alzheimer's disease. That we do now know that 50 to 70% of all dementias are actually Alzheimer's disease. And that's a specific disease that we can identify, especially post-mortem.
Okay.
And
So
the reason
much
why-
later.
Yes, much later. The reason why it's called Alzheimer's disease, it was because it was identified by a chappie called Alzheimer.
Okay.
Yes. There are other forms of dementia. The second most common one being what is known as vascular dementia, which has to do with the blood vessels. Now, when you say that it affects different people, yes, it does. However, we now do know the symptomatology, the set of symptoms that will help us identify whether someone has a dementia. Okay? And in describing a dementia, as I said, dementia describes this group of symptoms or disorders that actually affect the person.
Yeah.
And there are key symptoms that you can look out for to indicate whether someone has dementia. Some of the most immediately identifiable symptom is memory loss.
Okay.
Okay, that is one of the first things that happens. But there again, you see, memory loss cannot account for someone being diagnosed as having Alzheimer's alone.
Exactly.
We all have memory loss.
Yes.
And
At
there are
one
many-
point.
At one point.
Yes.
But there are also many other things that can cause memory loss and that can cause some of the other symptoms. For example, a brain tumor. If someone had a brain tumor, they would exhibit very similar symptoms. Certain nutritional disorders, for example, severe vitamin B deficiency, you'll get very similar symptoms. The symptoms or the displayed symptoms by a person after a stroke, not necessarily immediately after the stroke, but sometime after the stroke, okay, you can have similar symptoms. So it's not just those symptoms, let's say memory loss, that actually cause it. However, what Alzheimer's does...
What actually makes it then different?
What makes it then different? Yes. That's a very good question. Is the progressive nature of it. Alzheimer's is what is known as a neurodegenerative disease. Neuro has to do with the brain, neuro, nervous system. Degenerative, it is degenerating. Okay? So what actually happens in Alzheimer's or other dementias is, due to the processes that are going on, the cells begin to die. When the cells begin
the brain cells
begin to die, the brain doesn't replace those cells. When the brain cells begin to die, and also the neurons that actually transmit signals begin to die. When that happens, that particular area begins to get fewer and fewer and fewer signals. You see? Okay, you grab a glass. I'll grab a glass, okay? You've got brain cells.
Okay.
Brain cells. Now what actually happens is that when a stimulus comes from one particular cell, the neurons actually come out, send a signal, there's chemicals going through, and they go across to the next one, okay? From this to that.
That's the brain cells.
These are the brain cells. Now what actually happens when we're talking about neurodegenerative disease is that there are what are known as proteins. You know, we all know what proteins are, okay? In the brain, there are certain proteins that are no longer working properly. I'll give the technical name, but we won't go into that. These are known as beta amyloid proteins, and they cause what are known as plaques. And those begin to encircle and cover, okay, the brain cells. And for want of looking at it somewhere, you can imagine, so if this is supposed to get light, etc., if I do that, I'm covering
no light that is going
if we're using the equivalent of light for a plant, which is not what happens, but I'm saying if that is what's going on, and then that's what causes, okay, the beta amyloids are part of the reason of the eventual death of the brain cell. There's another protein called a tau protein, TAU, okay, and what those do is that they actually affect the internal aspects of the cell, the neuron. Now, with the combination of those two happening, this cell dies. If this cell is what is required to take the signal from here to here, or all these cells are dead, then this signal is no longer
not able to be transferred here.
Yes.
Okay.
Now, when it comes to memory and Alzheimer's disease and many of the dementias, is this process first starts happening in a certain part of the brain.
Okay.
The hippocampus. You don't have to remember that word. And the temporal lobes. Now, these parts of the brain are where signals go to and come back that have to do with retrieving memory, with laying down memories and retrieving memory, you see? Now, because this is the area that is first especially affected, that's why one of the first symptoms seen and noted by everyone else is progressive memory loss or lapses. Alzheimer's disease or other dementias, and I keep on using those two words together. Let me explain.
If you could just tell us exactly how they're related.
How they're related.
Alzheimer's and dementia.
As I said earlier on, dementia is a term that is used to describe a group of symptoms, okay, that are caused by certain disorders, okay? So that is what a dementia is. There are a number of dementias, of which Alzheimer's disease is the commonest cause of dementia. Okay, about 50 to 70% probably of all cases of dementia, it's now thought that 50 to 70% are caused by Alzheimer's disease. Out of all of them, the reason why that one has a name is because there was a really rather clever chap. I can't remember the time, but I think it was the turn of the 20th century, the 1900s, who,
a long time ago,
who actually noted post-mortem, while doing post-mortems of the brain, that what he found, the abnormality that he found on sections of the brain, of people who had a certain set of symptoms, it was always the same. Now, it's entirely possible at the time that they thought these people were mad, or these people were bewitched, or these people were this, that, or the other.
Yeah.
But what he noted is that this patient who died, who first of all had ABCD symptoms, the brain looks like this. Then the next one, patient B had ABCD symptoms, the brain looks the same. It's an abnormal brain. One of the first things he noted was how much the brains had shrunk. I'll get to that later.
Okay.
In the end, because the brain cells are dying, obviously brain cells are dying, they're not being replaced, the brain will shrink.
So that's the degenerating
Yeah,
factor.
degeneration actually leads to brain shrinkage.
Ah, I see.
So those were a number of things he started noticing. And he actually put this factor with that factor and identified there is a disease condition going here. And once it was accepted by others, it got his name, hence Alzheimer's disease.
So he was called Alzheimer,
Yeah,
and
the guy was called Alzheimer.
Yeah.
Yes,
Okay. So they named that disease after him.
Now, this is one of the specific identifiable dementias.
Okay.
There are others. As I said, there's what is known as vascular dementia. That is where blood vessels have become damaged, blood vessels are no longer feeding a certain area, the brain cells have died. This can happen because of a major stroke, or can happen because of a series of minor strokes. Now, a stroke is not Alzheimer's, a stroke is not dementia, but a stroke can lead to that area of the brains and the cells not getting the nutrition with the blood supply, and the cells beginning to die.
And at what point does a stroke lead to that part?
A stroke does not always lead to that part.
Okay.
No, that is not necessarily the case. However, a series of minor strokes might lead to the situation where the brain cells have died in the manner I described earlier on. A fairly large area. If it's in the temporal lobe or hippocampus, then you begin to get the same symptoms as the Alzheimer's.
Okay.
But because the process of the brain cells having died, having started, it then progresses neurodegeneratively.
Okay.
A stroke is not I don't want to get too technical. A stroke is not the same thing as a neurodegenerative disease, as in the degeneration of the cells. However, because of the stroke, that could have triggered that. I don't know if that has helped in any way. The key thing about dementia is, and a lot of people do actually then ask that, okay, if that's the case, and we aren't sure of what causes it, then how do you know it is there?
Exactly.
Yes.
How do you then get to
know it is there?
To say that this is dementia?
Yes.
Yeah.
Apart from the fact that I've already said we don't know exactly what causes it, I'm going to put another spanner in the works, that the only final definitive way you can actually make a clear and perfect diagnosis of, let's say, Alzheimer's is post-mortem, by looking at the brain.
Okay.
Even up till now. However, we do have tests that are not tests, procedures with which we can now be clearer. But
Right
I'll go
now?
back, yes, right now.
Now,
But I'll go
okay.
backwards. What you can do is make a clinical diagnosis, which is what has been happening since this clever chap Alzheimer's identified Alzheimer's disease and other dementias. And that is from taking a very good history, that is talking to the patient, talking to people, what has happened, etc., how have you been, etc., examination and investigations. A lot of the time it's important, depending on the stage, to do that history or that phase of it with family members. They'll be able to tell you what has been happening.
Okay.
Okay? I can use one example. I might be a doctor as well. But interestingly, I remember many years ago, my mother had Alzheimer's disease. I remember many years ago, my children were very young. They were the first people who noticed and said, but Jaja keeps on saying the same thing again. It was after they mentioned it that we realized that actually that happens. Now, when she would repeat things initially, she would repeat it but move on to the next sentence. So it was as if it was just a single repetition, but picking up from where she'd gone in the sentence. Okay, so we would just dismissive. You're busy. You're repeating things. And maybe she's repeated something while I'm
Tired
driving,
or something.
etc. But the children who noticed that, this is becoming more and more.
Yeah.
We then started recognizing it. picking up. Now, we did not respond immediately because it wasn't so bad. But then, but then there was a point where, partly because I'm a doctor, some of my other siblings are health workers, doctors and a nurse. We had the advantage, let's say my sister is based in Sweden. And at that time, a lot of forward-moving research was coming out of the United States and Sweden, out of a particular hospital. So we were going to visit my sister anyway. So I went with my mother.
You decided
specifically,
to go,
let's go and get certain tests done over there. Most specifically, we wanted an MRI done.
Okay, but were you a doctor by then?
Yes, I was.
So you had an idea what you were dealing with?
Yes,
okay.
Yes, I had an idea. And that actually is a very good thing, because by the time we were in medical school, the word Alzheimer's wasn't even in the medical book. And the amount of, the write-up in my internal medicine book was not that much, you see. So very little was actually known. I'm not going to tell you when I was in medical school.
It's all right.
No, but you see, so knowledge has grown. But yes, we recognized it, that this could be the issue.
Yeah. Aside from the fact that she was repeating herself quite often, were there any other signs that made you think, or was it just that?
No, not to that, not to that stage.
Okay.
Not at all. And there, advantageously, is I'm a doctor.
Yeah.
My brothers, 2 of them are doctors.
Oh,
I've got
wow.
a sister who's a nurse,
Yeah.
etc. So we did. It hadn't reached a stage where there are other things that were coming in.
Okay.
Interestingly enough, when we did go to Sweden, she was seen by a professor who was one of the guys who was developing one of the first drugs that came out. And I can remember that particular initial interview. It was clear she didn't want it. I asked her later that, why were you so reluctant? And she said, I had a feeling about what we were going to find.
Oh, she had an idea?
Yes, she had an idea.
So she knew that she would forget?
She knew about Alzheimer's.
Oh,
so
okay.
she had already started noticing
Oh.
that she's forgetting,
Okay.
you see.
Yeah.
And it's one of the things I learned about Alzheimer's from her as a patient that you never learn from the books. She knew that she was forgetting because she would get somewhere. She knows exactly what she wants to say. She knows the word, but she just can't find it. So she is aware that she has forgotten that particular word. Now that's the beginning stages. Now it never occurred to me from understanding it medically or reading about it or being a doctor or learning more about it, that actually was a factor. That the person knows at the start that I'm looking for a word I know I'm supposed to know. I can imagine it must be very frustrating for that person.
You know that you know the word, but
Yes.
you just, for some reason, you can't seem to get it.
Yeah. And so that's one of the first symptoms. You asked me, how would you know?
Yeah.
In taking the history, the family members might tell you about that, okay? They might tell you about how the forgetfulness has progressed. You see, I've just described an early part of the forgetting. If it progresses where they begin to forget more and more and more and more, and they begin to forget more significant things, like you and I, we forget.
Yeah.
We forget things.
Yeah.
That's normal.
Yeah.
I bet you don't know your full ATM number. You know your
really.
PIN, but not the number.
Not really. Yeah.
I bet you there are days you forget where you put your car keys.
Yes.
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 That happens to all of us. But once a person begins to forget that they actually have a car, or once a person begins to forget when they're at, let's say, Acacia Mall, and they had driven there, but they forget, it's not a matter of forgetting where they parked the car, but they forget completely that they have a car and therefore the ones who drove it there. That's a problem.
So there's a possibility that they will go to Acacia Mall.
Yes.
And they drove there.
Yes.
But when they're going back, they will take a border because they can't remember that they
Very
drove.
much so, yes.
Okay.
And even that you haven't yet reached the end stages.
Yeah.
Okay?
Yeah.
So those are certain aspects that you're looking for in the history of the person, a very thorough history.
Okay, we're still having this conversation and there is just so much, but let's take a break. I am sure we also need to digest this information slowly by slowly, so we'll catch you in the next episode.